The Edo State Primary Healthcare Development Agency convened a significant departmental debriefing session aimed at evaluating the agency's progress, addressing current challenges, and strategizing for future initiatives. The event, which was held in Jupsa, Benin City, was presided over by the Executive Secretary, Dr. Kusin Oyaimiri. The debriefing allowed the agency's various departmental directors to present the comprehensive report on the achievements of their respective units over the past month. Each director highlighted key programs, successful health initiatives, and collaborative efforts that have advanced the agency's mission for enhancing primary health care in Edo State.
Essential drugs and logistics is primarily saddled with the responsibility of ensuring the availability of standard and affordable essential drugs across primary healthcare facilities in the state.
Health Information Management System, which commonly we call the M&E, where we make use of the national tool, the district
PACs, we have 196 PACs. So we see that we have a lot of work to do, but that is what data help us to see.
The book is to guide against extra budgetary spending.
We are advocacy with the Department of Community and Family Health to ensure that the acceptance of our vaccines is high.
The Executive Secretary, Dr. Kusin Oyaimiri, during his opening remarks, emphasized the importance of such evaluations in fostering accountability and ensuring that the agency remains aligned with its strategic goals.
I want to say here that we have decided as a house to be having this monthly meeting, which will help us to strategize and plan further and identify our gaps so that as a house we can come up together and solve where the gap are.
Director, Community and Family Health Services, Dr. Idemudia Osayomori, says that the meeting is to evaluate the positives and negatives for further improvement.
So what we are having is a departmental debrief. It's one of the innovations and best practices of the present Executive Secretary, Dr. Kosin also here. He feels that we should be able to, as an agency, as department, should be able to come every month and assess our KPIs and see where the gaps are and develop next plans on how we intend to improve PHC service delivery in Edo State.
Personal assistant to the Executive Secretary, Mr. Emmanuel Nosa, says that the meeting is to revitalize primary health care in the state.
We needed at the agency to build on our strength, identify our weaknesses, and ensure that we cover and take very good use of our opportunities. So each department, each unit are making a very, very pragmatic presentation on what they have done so far for the month of September.
Director of Essential Drugs and Logistics, Pharmacy, Valentine Eraga, speaks on the responsibilities of his department while appreciating the Executive Secretary, Dr. Kusin Oyaimiri.
We are gathered here today because the Executive Secretary is organizing a program for all directors to explain what has been happening in our various departments, to know the challenges, the next steps, and the way forward, to see how everything can be harmonized so that we can get a better results for our department. Like, for example, I'm the Director of Essential Drugs and Logistics. My department is responsible for ensuring that there is affordable medications in all the health centers in Edo State. As it stands now, we have essential medicines in Edo State Central Medical Store. We have in Edo North and we have in Edo Central. It's the first of its kind in Edo State, whereby a primary health care has a drug recovery fund program and is successfully run by the Department of Essential Drugs and Logistics. And I want to say a very big thank you to my Executive Secretary, Dr. Kosin Oshokai, for the initiative for ensuring that drug recovery fund program is running in the state. And with this, all our facilities have drugs, essential drugs in our facilities.
Director of Finance and Accounts, Mr. Okeye Cosmos, speaks on his unit on how we cut across every other department within the agency.
During the course of the presentation, I explained to them my role in the agency, which is to manage the finances of the agency and advise the Executive Secretary and other directors on all financial matters. And we have various units in my department, units such as salary and wages units that is in charge of preparation of staff salary. We have the treasury services where we prepare cash book, payment voucher, and where bank reconciliation statement is equally done.
The departmental debrief of the Edo State Primary Healthcare Development Agency served not only as a reflection of past successes, but also a strategic planning session for the future. With the dedication exhibited by its leaders and staff, the agency is poised to forge ahead with renewed vigor in its mission to enhance healthcare delivery across Edo State. In Benin City, Osamu Jame Kennedy reporting for AFMI Reporters TV.